I'm Dr. Sheila Farhang, and welcome to Derm Approved, your insider access to skin that looks and feels its best. Welcome back to Derm Approved. We are now halfway through season 2, which is insane. And I thought this would be a really good time to answer your questions. And we did this last season and you guys loved it. And so we're going to make it a little bit like fun today. And we're going to have people from Dear Media headquarters, which is where we're filming right now, come in and ask their questions. They're all in their like 20s, 30s. We have girls, guys, we have all the things. And then I'm also going to pull up some of the questions that you guys asked me on Instagram and just answer the Ask Me Anything. So stay tuned. I love recommending Rock's new line smoothing 2-step peel pads as an at-home alternative to a professional peel without the cost, the downtime, or the irritation. It's a 2-minute treatment, Dermatologist developed, delivering the results of a facial at home. With over 250 clinical studies, 75 safety studies, and 35 patents, every Rock formula is scientifically crafted and clinically tested to ensure the best results for your skin. Visit www.rockskincare.com for more information.
You're so cool. Like the way you dress is so like
Stop.
fun.
I'm a cool doctor.
And I love it. Also too.
She always calls me the sexy doctor.
This isn't my question, but you do like Botox and stuff.
Oh, yeah.
I need like man Botox.
Oh, okay. Have you had it before?
I had it when I was younger, but like now I'm starting to get the forehead.
Yes.
You know, I didn't need it when I got it, but now I need it.
Yes. So why you know that you need, like one thing that I look at if people ask me like, do I need it? Or like, I feel like I need it is when you have those lines there, when you're not making facial expressions, which you do. You have those static lines there.
And I look dehydrated.
Exactly. Which, I mean, it's humid, it's summer. So skincare number 1.
Yeah.
Tell me your skincare routine.
I'm doing Dr. Dennis Gross face wash.
Okay.
And then I do a Shardy Darden peptide cream.
Love her and love that.
And then the Dennis Gross eye underneath.
Got it. Okay.
But also just like a general moisturizer.
Perfect.
But my skin, that was my question about my skin.
Does your skin feel dehydrated?
No, so I don't know if you can see here, but I have
irritation?
this very specific spot on my face. And I don't know if this is like hormonal. I've had my hormones checked, everything like that. And they're like, it's fine, it's fine.
Yeah.
But, and I guess it's probably to do with the gut as well. Because anytime my gut feels off, it's like a weird cycle. But I notice my gut's bad for a month and then it'll be good for like 3 months.
Yeah.
But I get like really bad ingrown hairs just in this patch here.
Just that area.
And then they turn into like these very hard lumps.
Yes.
And I'm like, I want to grow a beard, but I can't because I pluck and it's patchy, but it's so painful.
Yeah.
And I went to a Derm a Derm in Sydney. So this was over 5 years ago. They put me on maybe doxycycline.
Like an oral
potentially.
medication?
And I feel like that screwed my gut even more.
1000%.
Yeah. So I don't know. I just kind of like went with it and I've tried to cut out dairy. I've tried to cut out like all these things. And then I'm like, is it my pre-workout spiking something within me? But it feels like it's a cycle, right?
Yes.
And I'm like, it's just this patch
Yeah.
here.
Yeah. Okay.
Like what could that be?
Great things. Great points. I'm sorry you're going through this, but I see this a lot. So number 1, your gut can absolutely affect your skin, breakouts, redness, irritation. Some of the big food triggers include whey protein. I know you said pre-workout. Do you have any like whey protein, like shakes or anything?
I do.
Okay.
Yeah, because I'm like, I just can't eat enough like food to get my protein. So I'm doing that as well.
Try switching to like a pea protein.
Okay.
I know it doesn't have as much protein, but try that because that is way better on the gut. So try that. I'll tell you some of my faves. I mean, I'm like going through them as well. Some are like, Like I go through like 4-Sigmatic as a pea protein. Kachava is like one that people really like. I got this other one the other day. But yeah, try that first because whey protein can cause breakouts for sure. In general, like dairy can, like aside from like whey, it can, but it's not like a huge contributing factor. So I wouldn't like, I have people coming in, they're like, I'm on like the Whole30, like no gluten, no dairy, no nothing, only whole foods, no like inflammatory foods, and they will still break out. So I wouldn't say that it's like, it may contribute, but it's probably not causing it. Like you can still have cheese and all that stuff. If it upsets your stomach.
Because that's another thing. I'm like, it feels like a cycle, as I said.
Yeah.
So I'm like, is it a cycle though? Or is it just that I'm going off dairy to try and get rid of it? Or I'm doing all these things to remove it. And then I'm not like actively properly tracking that because my hormones look pretty tip top.
Yeah. No, it's probably like if we checked your labs, they're probably perfect.
Yeah.
And this could be a few things. So yeah, irritation, any gut microbiome.
Mm-hmm.
I always tell patients like get on a good probiotic.
Yeah.
Just cut out like whey protein first.
Mm-hmm.
Like you don't need to do the whole shebang.
Yeah.
And then you want to make sure it's only on one side. So you either might be, do you sleep on that side?
No, it's funny because I sleep on this side.
Crazy.
So like I sleep here and it's like, can you see
Yes,
this?
come in here.
And it's starting to scar.
Yeah.
You know?
They are a little bit bigger. So they're a little inflammatory. So I'm thinking, do you use a benzoyl peroxide wash?
No.
Okay, start with that, like a 5%. That's going to help decrease the bacteria just from like razor burn almost.
I also heard that like a sulfur wash is good.
Sulfur is good for rosacea. It's a little drying though, which is like, so is benzoyl peroxide.
Mm-hmm.
So try benzoyl peroxide first if you have any breakouts, number one. Next up, sulfur wash is fine. You don't look like you have a lot of like rosacea, and I think the sulfur wash might dry you out, but try that out.
Yeah.
Hypochlorous acid spray.
Uh-huh.
I'm going to write this all down for you.
And what about witch hazel? Because
Too
everyone
drying.
tells me witch hazel. Okay,
that
too
is
drying.
So drying. If you have like a gnarly one pimple that you want to kind of like dry out, but it's an astringent.
Uh-huh.
But that's probably going to irritate this because you're also like shaving it, right?
Yeah. And that's the other thing too. I'm like, should I be shaving? I think my biggest thing is I'm a plucker. I can't.
Oh yeah.
I love being groomed. I'm like a monkey.
Yes.
Do you know what I mean? Like, do you know you see them in the forest? I make my husband do that, and I'm like, whatever. But maybe that is also like
it's
I shouldn't
irritating.
be plucking, right?
Don't irritate them. Lay off the exfoliators right now. You want to improve the skin barrier. You want to decrease that bacteria. Not that there's bacteria there, but it can just like that inflammation will cause those like ones that hurt. And then if those things don't work, like benzoyl peroxide, hypochlorous acid spray, making sure you're hydrated, making sure you're not using too strong of actives to irritate the area. You're shaving down in that area, not up. I know that sounds really weird. Making sure you're using like a good aftershave.
You go with the grain,
With the grain, And if that doesn't work, I like to give a little bit of like topical, like either azelaic acid or a little clindamycin. But usually we can do this without like putting you on oral medication.
Yeah. Okay.
So that is and I see that a lot. Like bumps in the beard area in men it's super common.
Yeah, I feel like because I have curly hair as well.
Oh yeah, and they can curl curl back in.
And they grow like a cross.
And I will
Sometimes
say,
I see them
if you're plucking them or messing with them, they'll scar and and then they'll start like curling in and creating a foreign body reaction, and that's why you'll get like a recurrent cyst there. So
and I think that's maybe where I'm at. Like I've tended to it too much.
Yeah.
And now it's just like I can't get out of that phase.
Yeah,
and then
we can get out of it. We can get out of it.
Thank you.
Yeah.
This has been helpful.
So that is perfect. You were asking about Botox. I think a little mini micro baby Botox helps with those fine lines. Like we want to like lift you, make you look awake, and that's like really good. We don't want to freeze you.
Yeah, because I'm in that I need to get hot era. Like my metabolism stopped working. My face has started to kind of show my stress and I'm not old, but you know.
How old are you?
32, turning 33.
Oh, yeah. Babe.
Which I'm like young, but like,
you know. It. You're like, wait,
you see it
I want to look that.
Well, I think like 10 years from now, what am I going to, I did Claude. I said, Claude, ChatGPT to show me what I'm going to look like if I keep the same trajectory. I should never have done it.
Oh,
but,
no, I'm not even going to do that. I turned 40 next year. So
wait, what? You're 40?
Mm-hmm.
You're like 25.
Oh,
I'm not even saying that to flatter you.
Thanks. I do less is more. Like those things, like I have acne prone skin. I have a pimple right here. So I'm doing the same thing. I got the little clindamycin spray. I'll do my benzoyl peroxide, hypochlorous acid spray. Keep it gentle. A lot of drugstore products are really good. So yeah, you got to keep it really, and you got to like not pick and touch.
My biggest thing.
I know.
Okay.
Cool.
I'll think of that when I'm
Keep
in
me
the
posted.
Mirror. I will.
We'll
Thank
do
you.
round 2.
Round 2.
All right. Thanks.
So I've been hearing so much about Zerf. I want to get your thoughts on that. If you think it's worth it. I know it's still new to the scene. But
great question, Zerf. Okay, people ask me this all the time. And you are like a little bit of a younger demographic, which is why I think why you're asking me also, because it's not invasive. It doesn't have needles. You may be starting to see like some signs of sagging maybe. Right. And then the before and afters, immediate before and afters look so good. So Zerf is radiofrequency. There's a lot of technologies out there that have radiofrequency. Radiofrequency is just like energy that it immediately contracts the skin, but then over time it stimulates collagen.
Right.
So, you know, there's radiofrequency microneedling, which is one of my favorites, but it has, you know, you have to numb the patient. There's a little bit more downtime. There's little microneedles that go into your skin. So People don't love that. But
Right.
but in my opinion, going down to where we really want to like fix and stimulate collagen, I like better.
Okay.
Radiofrequency with microneedling, like Morpheus or whatever, Secret. Those are really good two devices. With Zerf, it came out of South Korea. So it's been there for a little bit. And it's been here since like October 2025. So barely, like not even a year.
Wow. So new.
It's so new. But it's been used and it's not like new weird technology. It's like we're not like, oh my gosh, it's going to cause cancer in like 5 years.
Right.
The thing about Zerf, and this might be a hot take, is I think people are posting their immediately posts after photo, and you will see contraction.
Right.
It will look amazing. And then I just literally had Erica Taylor here yesterday, or like right before you, and she was like, I did it. And then everything came back down.
Right.
So then it's like, okay, so we know it's non-invasive. We don't know how deep it's going. We know that it's not heating up and like melting fat, but is it heating up enough to actually do something?
Right.
I think the verdict is still out. I don't know if it's worth the thousands of dollars people are spending. I think that it has really good marketing, but I guess we'll see. I think the data, I think everyone's like getting it now, like in the last like month or two. So then I think in like 1 or 2 more months, we're going to be seeing like people being like, oh yeah, that lift that I saw right afterwards, it's like, and now I see that.
Right.
I don't know.
Yeah.
So I don't think it's worth your money right now, especially you're young. Like for you, if you were like, I do want like a little bit of a lift. First of all, we got to make sure you have like retinol on board.
Yes.
Looks like you have a little bit of like sensitive skin rosacea. So retinols might be a little tricky for you to find.
Yes.
Medicate has a retinol that's really gentle.
Okay.
You want to focus on skincare with peptides. Peptides help stimulate collagen as well. It's non-irritating.
Okay.
Medicate has one. SkinCeuticals has one. It's like Botox in a bottle. It's not really, but it has PTX.
Okay, yes.
Love that.
Hear that everywhere.
Yeah, love that product. And then for you, because you're like in your 20s, right?
Yes.
Yeah. So microneedling is so good for like fine lines. You really don't have a lot of fine lines, but I think that that's going to still stimulate collagen and do something.
Okay.
You just have to be careful with your rosacea, not to flare that.
Yes.
What else will stimulate collagen on a deeper, like what bothers you?
Well, more of just like a texture.
Okay.
Kind of like resurfacing.
Yes.
So I've been doing tretinoin.
Yeah. Ooh.
But kind of balancing that because like you said, like I have super sensitive skin. What about red light for stimulating collagen?
Yeah, I love red light, especially your age. Yeah, you just have to be so consistent with it.
Okay.
So red light, we know like on a sign. Oh, by the way, like Zerf doesn't really help with like resurfacing. Like doesn't do anything for like texture, acne scarring. It literally is like heat on the skin, which doesn't do anything on the outside and just tightens the skin. So for resurfacing, yeah, like texture, like old acne scarring, large pores, oiliness, like all that you see, like microneedling, it's like a couple $100 versus like a couple $1,000s for some of these lasers.
Right.
And I love that. Sometimes what I like to do is like rub like growth factors on top of that glass skin. Love that.
Amazing.
Red light, I'm a huge fan of. It does work. It's not like a facelift result, obviously.
Right.
You just have to be, it's like brushing your teeth. You just have to be like consistent with it and use it as long as it's like a brand that's like Derm approved.
Yes.
So like Sofwave is a really good one that is so affordable. It's a soft one. Omnilux is another soft one. Dr. Dennis Gross has a hard shell one. Shark has one as well. That's a hard shell one. That one is my favorite, the Shark one, because it has like a cooling thing too. It's good for rosacea. If your red light mask, like you got one randomly on like TikTok shop and it's feeling hot or warm, that means it's pulling in infrared and that's not good. You don't want it to feel warm and it's going to worsen your melasma. Like if it feels like you're going into like a infrared sauna, wrong, bad. Take it back, throw it away. But it should just feel pink and you may be a little flushed because it stimulates collagen, increases circulation, decreases inflammation. And although it may worsen melasma a little bit in some people, I don't think it like worsens your rosacea.
Okay. Amazing.
Yeah.
Thank you so much.
Of course.
So I have previous filler
Got it.
And I've gotten that filler dissolved before.
Okay.
And I'm always so curious, what do you look for in a patient who has had previous filler? Are you more inclined, like how do you, is there something that you can't do? Is there anything that you look for in specific? And I was giving this kind of analogy of how tattoo artists look at previous work. Like some people are inclined to be like, I don't want to even touch that.
Yeah.
Versus how do you build upon that?
That's a really good question. So in my practice, I dissolve a lot of filler and I also will refill them. Depending on the location, like where did you have it dissolved? Under eye or lips or where? Got it. Yeah. So with lips, I usually am like, go for it. Like if you have migration or you don't like the way your lips look, like let's dissolve it.
Yeah.
A lot of the studies show like it's not going to actually like deflate, like it's not going to dissolve your actual hyaluronic acid in your skin, like with the way we do it. And I've done enough of dissolving to see that like it just shrinks it. The reason why people don't want to like touch old filler, and it's really provider based. Like I'm an advanced injector. Like I want to be there for my people. I want to be there for people who went, they didn't know, like you didn't know, like you just went, got your lips done. You're like, I don't really like it. Got it dissolved. Or some people will get it. They went to someone maybe that wasn't really good and they got migration, or they didn't tell them when to stop, or maybe then they just did too much. So what I tell people is that we can totally dissolve it. I like to wait 2 months before redissolving. Not everyone will let me do that because they're like, I have tiny little baby lips, but the longer the better because that skin border, like lip border can heal. And I will refill, but I will always tell them like it won't be as perfect as me injecting like virgin lips.
Yeah.
Because that crisp border has already been compromised because filler has already migrated, that like there's like kind of like a border there. So it's like if it's been pushed through, number one, if you dissolve it, you do want time to let that heal. Like some people will, and I've done this before with a patient a long time ago where she came in from out of town and she had like some other stuff. So we dissolved her upper, the migration there, but we did dissolve her lips too. And we waited like 2 weeks, which was like the kind of like, what people do a lot. And then I went in there and it just wasn't like as crisp. They looked gorgeous. They still looked really good and better than what it was before, but it didn't have that like really nice crisp border. I feel like if maybe we wait a little bit longer, it would have like healed more. But that's kind of the only thing that I tell people. The reason why some injectors are like, oh, I don't want to deal with like people who've gotten filler, bad filler, dissolved filler is because it is harder. It's much harder to inject and get a good result with like not a perfect canvas. And not saying that we can't do it. Like I'd rather someone get the filler dissolved and us do it than me be like, no, it's not going to look as good. So I don't want my work, like that's like an ego thing. But I think that, I guess it's same with like tattoo artists where it's like maybe like an ego thing, but, or like like how good they're trained,
Right.
Like I think that it does require a little bit more of an advanced technique to go in there, especially for the under eyes.
Yes.
So for the under eyes, when someone comes in and their under eyes are puffy, they're swollen, they're boggy because of bad under eye filler. And bad under eye filler can be from where the injector placed the filler. Like, was it too superficial? Was it too deep where it's obstructing your lymphatic flow? Too much filler and the wrong product. So usually you need to do very little bit. Like some people would do like one whole syringe of filler in the under eye. I do like a quarter. So when someone comes in though, I have a whole protocol for the under eye, which is we dissolve it. I do 2 sessions of that just in case like we feel like we need to dissolve a little bit more because it's not like a perfect science to like dissolve. And I'm sure, you have that with your lips. And then I'll go in and tighten the skin because if you do have a little bit of stretching, it doesn't happen with the lips as much, although I've seen it where people have gotten so much lip filler and I dissolve it and it's like deflated. And then we kind of have to address that. But for the under eyes, you will see like usually crepey skin there because of the swelling. And because they got the filler for a reason, which is to fill the area. So then when the filler went away, people are like, oh my gosh, I look so old now. So I have to tighten the skin. I'll tighten it with radiofrequency microneedling and a CO2 laser to tighten that skin. And then I'll go in and heal the skin with PRF, which is like I draw your blood, spin it, and it kind of regenerates and heals the under eye where we can improve that like lymphatic flow again. So like things don't feel so swollen. And then, believe it or not, I will fill if I feel like we need to. And some people are like, what? Like, I thought filler was the problem. And I'm like, no, filler was not the problem. It's just how it was filled was the problem. So same for the lippies. I go in, I dissolve them. Usually about 2 sessions. It's not as bad as what people think. Like on the internet. Yeah, right. Was it like so bad?
It wasn't. And I've gotten them dissolved twice.
Yeah.
Just because we were wanting to go with a more like, what's the word I'm looking for? Like minimal approach. And then we ended up just doing the whole thing.
Love.
And it wasn't as painful as people think.
Yeah.
But it obviously, like, everybody's pain tolerance is different.
Exactly.
So,
but I feel like on the internet, people are like,
scary.
oh my goodness. And I will say sometimes I will dissolve and sometimes I won't. If not, I'll apply ice. The actual product does burn a little bit. So, and people get really swollen sometimes. But I think like just get it dissolved. Like some people are just holding on to it. And it's like really, really like, did yours like migrate a little bit, or was it like a shape you didn't like?
It had I had a small migration on the sides, just because the corners of my lips tend to curl in a bit, and I wanted it to like pop out, and it just didn't work out that way.
Yeah.
So a follow-up question for you is, when you do refill, is there a product that you are more inclined to use for the refilling versus, like, I think my original one that I had was. It was a Juvederm product. Yeah. And I know people say like Juvederm, Moviderm.
Moviderm, I know it is. Especially if it was like Juvederm Ultra Plus. Those are really thick products and they can migrate. I think that it really depends. So if I'll usually use one like that's in the middle. So I don't think like all Juvederm products are bad.
Right.
Juvederm has a Volbella product that I really like. And that's like half structural, like Juvederm, like Ultra Plus is like very structural, very thick. And that's why people end up looking like too stiff in the lips. It migrated a lot because it was just like a product that like, it was just too much and too much volume was placed. And then people used to inject really deep, like into the muscle. And I inject so superficially to get that nice lift. So I think that's a different thing. But I think it depends. If someone wants like a nice crisp border, I'll use like a Volbella, which is like half structural, half hydration. If we like the structure of the lips, but we need like hydration, I'll go like a little lighter, like Refine. Galderma has a product called Kiss, which is a little bit more structural, which I like too. So I guess it kind of just depends. I don't feel like, although we like say Moviderm, like Ultra Plus, those are strong. I feel like a lot of the issue is really like how it was injected too.
Right.
Like
the technique.
1000%.
Yeah. Oh, you've given me a lot to think about.
Yeah, exactly.
Maybe I should go back in for a little touch.
Yes. Happy to see ya.
Yes. I know exactly who to go to.
Yes. Thanks.
Awesome. Thanks, guys.
All right, Miss Producer.
Hi. How's
Look
it going?
who's in the chair now.
Yes, I know. Behind or in front of the camera this time. I have not started doing anything yet.
Okay.
And I'm starting to, just start to prepare. I'm like turning 30 at the end of the year. Like I've been using retinol for a year and I use it every night now. So I'm using a 0.3. I use vitamin C in the morning, a basic CeraVe moisturizer, and then I do use a beef tallow at night, like a nice beef tallow that I really like. Actually,
your skin looks good.
Thank you. And so I'm just kind of wondering, like, what is the best like way to prepare myself for my 30s?
Yes.
And, like I want to keep it natural and I don't want to like look like I have a stiff face, but like, just thinking about longevity.
Yes.
And my skin.
Love. You're like the perfect patient where you're in your late 20s, approaching 30s. This is when you're starting to see the lines. All your friends have maybe had Botox and you're like, am I missing out? Do I need to do this? How do I know I'm a good candidate? I don't want to look like some of my friends, but some of the other ones I don't even know that they had it. So like, what do I even do?
Yeah.
So I always say, you've heard me say this a million times with with clients or with the guests here.
Yeah, with the guests.
With the guests is the way you know you're a good candidate for starting something like Botox, baby Botox, is if you start seeing those lines stuck there after making that facial expression. So you're like, okay, I went like this, raised my eyebrows, but then like I brought them down and I still see them. So that is a good time to do it. So then so you can so Botox does a few things. So Botox, well, it relaxes the muscle. So it's actually like a liquid that we inject like baby little injections into the muscle. These set of muscles between the eyebrows, these ones here help the 11s. And then it also, because the muscle between the eyebrows get relaxed from Botox, the muscle up here, the frontalis muscle actually raises up and overcompensates because this gets stronger because that one's relaxed. And that's how you get the nice lift. And that's what I do for my face. So sometimes it's not even like the wrinkles. It's some people are like, I just want to like look a little bit more lifted. You know, that's what I do for myself for Botox.
It's almost like weightlifting for your face. You're like
1000%.
doing a different
it's
part.
Physics. You like you have like this tug of war. One muscle is relaxed. The other one is gonna overcompensate and pull up because it's just stronger because the other one can't. Yeah. So it's basically like going this way because this side is relaxed and then the other side is like stronger. So it's like a tug of war, and that's how you get the nice brow lift. So because I cannot be mad right now, but I can be surprised. So and that's like my little like trick on because I want a lifted eyebrow.
Yeah.
For you, what I would do is baby talks.
Okay.
And like say you were like, but like I don't know if I want Botox. What else is there? Here are the things that you could do. Retinol is great. I think adding some more elegant skincare products like peptides, peptides like neuropeptides, like the PTOX helps static lines, those lines that are still there. Medicate has a really good peptide that's like a little bit more good for starting. It's a little bit more affordable than some of the other peptides there.
Okay, cool.
Inherently, like peptides are a little bit more expensive than like a retinol over the counter. Okay. But I think adding some of that, sometimes it is like a little dehydrated skin. Your skin looks really nice and hydrated, so I don't think it's that. Okay. A little bit of like exfoliation once a week can kind of help. Not those like, not the muscles, you know, but it can help with like exfoliating some of that like dead skin that's like, you know, that's maybe contributing to the dullness or anything like that. Microneedling is like the perfect treatment for your age, and it's so underrated. I know it sounds scary, but it's just vibration. It's basically little microneedles going in and out, and that creates like little controlled injury, and your body actually stimulates collagen, and it is perfect for fine lines, these little fine lines here. So say if you didn't want to do Botox, we would do that. The thing is, we'll get to a certain point where we like it, and you won't have lines there, but then you're still making like facial expressions because you are a bit expressive, I would say, like I am too. But I still have lines there that I have to be okay with. But like I want to soften them. So then that's where the Botox is really nice because we've done all this work. You've already treated those lines that were there. We're doing a little Botox to help prevent those soft, like basically the Botox goes in the muscle. It'll soften those lines that are there and it prevents the lines from getting worse. Okay. So it shouldn't feel heavy. I would say Botox, baby Botox, about 20 units. Okay. I would do like a little bit between the forehead, maybe a sprinkle on the forehead, like between 6 to 8. Yeah. Like 20 to 24 is frozen in the forehead. So I do like a fourth, a third, or a half of that in the forehead. And then sometimes I like to do the lateral eyebrows to help lift that too. Just give like a lifted look. Yeah. So that's like my game plan for you. So, cool. And then with Botox, you do it every like, it lasts about 3 to 4 months. Not saying that you need to do it every 3 to 4 months, but that's typically how long it lasts. Sometimes people do it like twice a year. Some people just want to come in a little bit more often when it completely wears off. And I will say one big myth is people are like, if I start Botox, do I have to continue it for the rest of my life? And like, no, you don't, because you're not going to look that different. Right. You can just like ride it out if it's not for you. Yeah. Although people usually just love it, unless they get too many units and they feel heavy and restricted and claustrophobic. Right. Yeah. That's a bad thing. That makes sense. That means they did too many units. Okay. But yeah, less units, you get a nice lift. It looks a little bit more natural. The types of Botox brands, like Xeomin, tends to be a little bit more like softer. Okay, yeah, I was going to ask you what you use. Yeah, I have them all. And I have Daxxify in my forehead, which is like the strongest. Okay. And it lasts the longest because I just don't have like that much time to re-inject myself. But Xeomin is a really popular one. It's like purified. It's called Smart Tox. It's a little softer. It's a softer molecule. And I would say in my LA patients and my Tucson patients, that's like especially for first timers, it's a really good one.
Yeah. Okay, cool. And it was funny. I actually got a facial done for the first time in like 2 years a few weeks ago.
Yeah.
And like my lines were gone. And because I never exfoliate, because I didn't think I really had to because I was using retinol, but my lines were gone for a week. So I was like, okay, I guess I should be exfoliating. Do you have a recommendation for an exfoliator?
Yeah. Everyone says, like, everyone's so scared of exfoliating, but I think it's so great. And all you need is like a gentle exfoliation. There's a few that I like. So when I'm looking for ingredients, I like to look for lactic acid and glycolic acid. Those are like, salicylic acid is also one, but that's for like oily skin. So for you want to look for like lactic acid, glycolic acid, mandelic acid. Those also brighten the skin and help increase cell turnover and kind of like slough off the dead skin. Paula's Choice has some really good affordable ones. Skin Medica has some good affordable ones. The pads are fine. You just have to be really careful not to be super aggressive.
I use a glycolic, The Ordinary, like the basic one.
Great.
So is that an exfoliator? I do that once a week, but just not. Okay. So I guess I am technically. I'm just like not getting like doing a.
It's just
super
really
intense.
Gentle.
Okay.
So you could up it a little bit. Yeah, I think it's a few percent. I don't think it's more than like even 5%. But glycolic is great.
Okay. Yeah. So how many times a week would that be? Like
I would say.
And can I mix it with retinol? Because I feel like I when I do my retinol, I don't do the acid.
Other stuff.
Yeah.
You can, especially if you can tolerate it. So the Ordinary especially is very light. So that's a serum. So you would do that first and then you can put your retinol on top.
Okay.
Yeah. Because you're not doing prescription retinol, right?
No, I'm doing the First Aid Beauty.
Love. Yeah.
One. That's 0.3. Because I have sensitive skin. I have been doing it with an oil. Like I'll put an oil on first and then put the retinol on. But then I was talking to the facialist and she was like, I was like, should I go up now?
Yeah.
And she was like, you should just try
without.
And that's what I've just started doing. And then I'll like go through that. I'm thinking, and then I'll go up to 0.5.
Yeah, I think you'll be good. You're being like very good and careful. And the reason why no oil first is it's kind of creating like an occlusive barrier. So then your retinoid's not getting absorbed as much as you want it to.
Yeah.
You can always oil afterwards.
Okay.
Yeah. So like sandwich.
Hydrating.
You're kind of doing like the sandwich method, which is like moisturize before, put your retinol, and then moisturize after. I know First Aid Beauty has like a very gentle. So I think you can just like go for it. And then one night, maybe try them both together. Yeah, I think that's great. Ordinary is great. Yeah. Okay. So affordable, clean stuff.
Yeah. And it's just like, it's exactly
like
what
low
it is.
Risk. Like you get it. If you don't like it, fine.
Exactly.
They do have one that's like orange or purple or something that people were a little reactive to. Like my sister, I think, kept it on forever. But other than that, they have some good stuff.
Okay.
Yeah.
Okay, great.
Cool.
Thank you so much.
Yeah, of course.
Appreciate it.
I appreciate you.
Yeah.
So as someone who recommends starting a retinoid, which is the gold standard for anti-aging, it helps increase cell turnover, stimulates collagen. Not everyone can get on board with the retinol. It may cause irritation. They may be a little bit more have sensitive skin, like with rosacea. So I always tell my patients, if you want to start a retinol, try a Retinol, and Medicaid has a really good one that has almost like different stages. They can start really low and then go up from there. But Retinol tends to be a little bit more gentle, so it's not going to cause as much irritation or any irritation in someone who really wants to get on the retinoid game. I often see patients in my practice asking what they can do at home to treat fine lines and wrinkles, and I always love to recommend using Medicaid Liquid Peptides Advanced MP Face Serum. This is literally the serum that delivers clinically proven wrinkle reduction thanks to GF mini protein, which is growth factor. Medicaid's Liquid Peptides Advanced MP Face Serum is powered by the GF mini protein, which mimics the function of natural growth factors but penetrates deep into the skin to visibly improve the appearance of skin structure over time. So if you didn't know, growth factors are naturally occurring proteins in the skin that support the overall skin health and can help promote younger, healthier looking skin. However, growth factors applied topically are way less likely to penetrate into deeper layers. And that's why finding a good product that does that is so important. I recommend Medicaid's Liquid Peptides Advanced MP Serum for any of my patients looking for visible wrinkle reduction. I also love their Retinol. You can find these products online at medicaid.us. That's MEDIK and the number 8.us. Use code DERMAPPROVE for 20% off your order. So as a dermatologist and skin cancer surgeon, you guys know that SPF and sun protection is my number one. And I know it's really hard to find a sunscreen. It's so hard. Some of them are chalky. They leave a white cast. They break you out. They make you feel like super oily. EltaMD is just one of those sunscreen brands where they literally have a product for everyone. If you have more dry skin, if you have rosacea, if you want a little bit more hydration, if you are working out, this is what I love about EltaMD. EltaMD is not only the number one dermatologist recommended and trusted professional sunscreen brand, but dermatologists use EltaMD personally more than any other sunscreen brand, and I can vouch for that. EltaMD sunscreens are formulated with ingredients to help protect and correct UV damage across skin types and skin concerns. If you struggle with dry or dehydrated skin, you need to try EltaMD UV Daily Hydration Plus SPF 50, available in untinted and tinted version. Based on a 12-week study on 32 participants, this product is clinically proven to provide 24-hour hydration, and 100% saw improvement in hydration, plumping, fine lines, and wrinkles. They really do it all in their formulations so people don't feel like they're actually wearing sunscreen that they don't like. And that's what I love, because I'm like, people need to wear sunscreen they actually will use and they like. And EltaMD is one of those products that I always recommend. And remember, you need to wear sunscreen 365 days a year. Visit www.eltamd.com to shop and learn more. As a derm who focuses on cosmetics, it is so hard to find a good under eye cream. Of course, I'm trying to fix the under eye area, but I get a lot of questions on what products I recommend. So for the under eye area, people are asking me about dryness, fine lines, puffiness, dark circles. And with a lot of people even like losing weight, or people, we're just tired. All right, we need some help under the eyes. Developed with dermatologists, I love to recommend RoC's Revive and Glow Eye Balm. This brightening eye cream is formulated with vitamin C and peptides, clinically proven to reduce puffiness and dark circles while brightening your under eye area. In just 1 week, 96% saw healthier looking eyes and 90% saw brighter eyes. And in 4 weeks, dark circles and puffiness are visibly reduced. The innovative cooling stick glides on invisibly with a unique touchless application for powerful results. It's available at Amazon for less than $27. Visit www.rockskincare.com for more information. Okay, so first question from someone is, I want to do the things. I want to get Sculptra. I want to do radiofrequency or Sofwave, but I heard that if you plan to get a facelift in the future, these things cause scar tissue. What do I do? So this is something that I talk to my patients a lot about, because you will hear plastic surgeons say, oh, if you get certain procedure, Sculptra, threads, radiofrequency, these cause scar tissue. And then you'll hear other plastic surgeons say, no, these are fine. We do these in our office and we recommend these to patients. Like, no one can go from nothing straight to a facelift. So I say that it's all about the balance, right? So anything that you do to your skin will cause some type of inflammation, right? Even cool sculpting. So I do a lot of like neck and double chin lipo. And sometimes a patient will forget to tell me that they did cool sculpting underneath, which is just freezing the area. It's not even hot. It's just freezing the area. Or they'll do Kybella. And when I'm going in there, sucking out the fat with a little tool, I'm feeling that resistance a little bit. It's not like gliding like butter. It has a little bit of like scar tissue there. So do I think that they're going to get like a really bad result now? No. Does it make my job a little bit harder while I'm doing it? Yes. But I don't think in that case it's compromising their result. It is adding a little bit more work on my end, and they may have a little bit more downtime and irritation afterwards, but I don't think it would make a big meaningful difference where I'm like, don't do cool sculpting, don't do anything non-surgical before you do something surgical. I think that non-surgical things are there for a reason and that we should do them. Sculptra is a powder. We add water to it. So we're injecting literally liquid into the face to stimulate collagen and can give a little bit of like a tightening effect, which I love and my patients love, and people are obsessed with this treatment. Yes, if you do maybe so many vials, typically it lasts about 18 months, although it's also stimulating collagen. But say you did like so many vials and then like a few months later you went and had this like full deep plane facelift, there may be some, not issues, but there may be a little bit, maybe scar tissue there, I don't think it's enough for the plastic surgeon to give you a worse result or anything like that. Like, again, these non-surgical things are there for a reason. So I don't think anyone now should be worrying about not doing anything for facelift they're going to get like 20 years later. As far as radio frequency or ultrasound, anything like that, again, we are contracting the skin. This is using heat, and if done appropriately, we're not like targeting fat or anything like that. We're stimulating collagen on like contracting tissue on a deeper level. So could there be a little bit of inflammation there because that is like tightening and doing the thing? Maybe. But again, for me, I personally do all of these things. Radiofrequency microneedling to help tighten my skin, injectables, PRF, and Sculptra. So these are things, and I do plan to get a facelift in decades. Like I will get one, but these things are maintaining me until I get to that point, because people are also going to look really odd when they get a facelift and they haven't maintained doing any skin tightening lasers. Your skin quality doesn't look good because you're so nervous to even get any type of laser or microneedling or anything because you're like saving it for the facelift. I think that is really, I think you're doing like a disservice to your skin and your facelift. I think by doing some of these non-surgical things, you're actually going to get a better result and a better facelift. Of course, with anything, people go crazy and have like 20 syringes of filler, and they have threads, and they've done face tight or any type of internal heat where it's like you have the probe inside the skin. Those types of things will cause issues that I think may impact a facelift. But the regular stuff, Sculptra, radiofrequency, ultrasound, injectables, like a little bit of filler here and there, you're good. Like, don't be scared. Next question. What are your thoughts on the vibration plates? All right. So this is like a very trendy health and wellness, longevity trend. I guess you could say trend. People have been doing really in the last year. I think people really picked it up. I even bought one myself. So it's basically, you get this like vibration plate. You can get it from Amazon. I think it's like $100, something like that. And it vibrates like this. It goes up and back and forth like crazy. So, and I did a deep dive on all of this, and this may be a hot take, but I really looked at what the vibration plate does versus what a power plate does, which is completely different. So the vibration plate goes back and forth. It can help help decrease swelling because it's getting the lymph flow. Will it help muscle tone? Maybe. Will it help bone density? I don't think so, because of the way it's oscillating. And so people just love it because it's like their workout, their thing. I don't think there's anything wrong with it. I personally get so itchy when I'm on those, and I feel like I'm like tearing my thighs apart, because like tearing my thighs like up because I'm just like so itchy from the vibration. So if that happens to you, like, you don't need to do it. I have like really bougie, but I have a concierge medical doctor that he's an MD, but he does a lot of like functional, integrative, like full body stuff. And we had this like big thing because I have osteopenia. I have like weaker bones, just I guess genetically, I don't know. And so what I did a deep dive on, and what he recommended was a power plate, which is kind of like a vibration plate. And you see these at like chiropractor offices or physical therapy offices and like some workout places. And it is like a vibration, but you feel it in your core, like to your core, like your bones, your muscles. It can even make you feel like a little nauseous. So that's like $1,200. So I got that, and I've been on that because I feel like that actually has studies to support, like helps with muscle, helps improve muscle, helps improve like bone density and stuff like that. So if you're going to be on it every day and you have like weak bones, or you want to like strengthen your muscles, your bones, I would invest in like the power plate one. It just feels a lot different. It's just like feels like a vibration that you have to like hold steady. You're not just like oscillating back and forth. So that's my hot take on that. If you're using it, just do a little bit more research on the vibration. And also if the vibration is not for you, like don't use it. And lastly, I want to start a laser. Where do I even start? Okay. So laser is like the umbrella of this technology of energy-based devices, right? So I would say for like my patient who hasn't really done anything, say they're in their like late 20s, 30s, 40s, and they're like, I heard everyone gets a laser. I want a laser. Where would I have them start? I would ask their concerns, and it's usually texture, pores, maybe a little pigment, like sun damage, and lines, fine lines. We don't need to do any intense laser for those things. You could do a very light laser. So in my office, I have a very light CO2 that I can do that's kind of like a laser peel. So basically, it exfoliates the top layer of the skin. I had a laser, and I'll show you guys some photos. I had a triple laser a couple weeks ago where we did a laser for my broken blood vessels around my nose. And I had a little bit like on my cheeks and chin from like, I don't know, rosacea. Then we went in with an erbium, which is a more gentle, not gentle, but it's like better for darker skin types. But it's like basically a CO2 resurfacing laser for a little bit of the texture and pores that I had in my cheeks. So we did that full face and for like tightening around my eyes. And then I went in with, we actually went in with Moxie. That helps with, it's just pigment. And so I did this trio laser. And I do a lot of these trio lasers for my patients. And I also add in radiofrequency microneedling on the same day to help really tighten as well. So it's all about laser stacking. Would I necessarily do that for a patient who's just starting off? No. But I would say that if you came to my office and say you're in like your 40s, you're complaining of like under eye, maybe starting to get bags. You have crepey skin under your eyes. You just feel like things are dragging down. You have jowls, you have texture, you have pigment, you have deeper lines, you have fine lines. Then I would do a laser stacking. I would do a little bit of skin tightening with radiofrequency and then go in afterwards with a CO2. For my more mature patient, and then sometimes I'll add the pigment laser too. For my more mature patients, I would actually even go in with microcoring on the same day, which is a non-surgical way to remove sagging skin and basically cores it out. And then I do the laser. And so that is like a really advanced way to tackle your skin without Botox, filler, or anything like that, using things like lasers. So, and energy-based devices. So I love lasers. I say if you just start, they are a little bit more expensive. Lasers are. They're a very big, like machine, you know, they cost like $250,000 to $500,000 sometimes for the practice. They're a very expensive thing. So treatments usually cost, like if it's a light laser, sometimes they can cost like $800-ish. If you get more intense lasers, they can cost about $1,000 to even like the more intense, like a few $1,000s for like a full treatment. But so if you're like just starting out and you have fine lines, texture, like start with microneedling first. That is not a laser. It's a few $100s. At least that's what what we charge our patients. And that is just like the biggest bang for your buck. So don't feel like you get FOMO if you're not using a laser. There's also obviously like laser hair removal. IPL is a type of light-based device. It's not technically a laser, but everyone kind of thinks it is. And that gets rid of brown spots and broken blood vessels. So if you have rosacea and sun damage, that one's a really good one for you. But yeah, there's so many different types of energy-based devices. And the two main skin tightening laser, they're not lasers, but energy-based devices include radiofrequency and ultrasound. So those are two technologies that actually don't do much on the top layer of the skin, but they go deep and tighten the skin by stimulating collagen and contracting that tissue. So I think we did pretty good. We touched on injectables, lasers, filler migration, like some medical derm stuff. If there's anything that I missed, please send them over. You can go to @Dr. Sheila Derm on my Instagram. I'm happy to do another one of these. Or if I didn't get to your question, I'll do like a little stories and answer the rest. So, and also a quick note, we are taking the next 2 weeks off, which I know everyone's like out for the summer also, but don't worry, we're coming back August 19th. See you then.